going to be recording Blair and she checks off on chest and lungs. It's Saturday, October 12th at 1:37 and her 15 minutes start now.
Right. Hi, I'm Blair. I'm a Liberty nursing student. Can you confirm your name for me?
Blair Cooch.
Okay, Blair, I'm just going to start by assessing and inspecting your chest and lungs today. Okay, first I'm just going to look. You have good symmetrical shape of your thorax. I'm just going to look at the color to see if you have symmetrical color. That's good. I see a few papules, maybe a few macules. Nothing that would be abnormal. I would normally do your vital signs, but I'm not going to do that today. The normal respiratory rate would be 12 to 20, but you don't appear to be struggling to breathe. You seem to have regular rhythm and rate. Do you feel any tenderness?
Nope.
Okay. No tenderness. Next, I'm going to check the midline of the trachea. Alright. And the suprasternal notch, the angle of Louis, and then the coastal angle. Okay, everything's midline and it appears to be intact. I don't see any abnormalities such as collosis, scoliosis, pectoralis carinatum, which would be like protrusion of the chest, or pectus excavatum, which would be intrusion of the chest or barochest. Your AP diameter doesn't overlap the transverse diameter, so that means you don't have barochesting, which is really good. Let's see. Next, I'm just going to do thoracic expansion, and I'm just going to put my hands right here on your ribs. And when I say take a deep breath in, just take a deep breath. Okay, ready, go. Okay. Your ribs they went up symmetrically, so that means that you have good distension of the ribs. Okay, and then I'm also going to check for tactile firmitus on your back. Okay, come back around. Okay, and when I touch your back, just say 99, 99, 99, 99. Sorry, let me put that up. 99. Okay, good. I did feel normal vibrations. It did decrease when it went down, so that's good. Also, it looks like you have diaphragmatic breathing, which is just saying that you breathe from your diaphragm instead of, from your chest. Next, I'm going to move on to percussion, and I'm just going to start by percussing the back, checking for resonance, hyperresonance, dullness, or flatness. Yeah, and just hold your shoulders like that, and just breathe regularly for me. I'll just percuss. Get your squish bug out a little bit. All right. I didn't hear anything unusual. I heard resonance, which is just normal percussion. Next, I'm going to move on to auscultating, and I'm going to start by checking your diaphragmatic excursion. Now I'm just going to pull this up a little bit. I'm going to start from your scapula, and then move down, and then I'm just going to percuss. Let me start from your scapula, okay? Oh, wait, start over. Okay, take a deep breath in. Okay, and hold it when I say let out, let out. Okay, sorry. Okay, now I'm just going to mark that right there. All right, now let out. And now I'm going to start from the same place and move up, and so I'm just going to have you inhale and exhale and hold it. All right. All right. Mark that right there. All right, and the normal diaphragmatic excursion is from 3 to 5 centimeters. And then I'm just going to verify that it was from 3 to 5 centimeters. Oh, there it is. And it was. it was right at 4 centimeters, so you're normal. I would do the same thing on the other side. The right side would be a little bit higher because the liver is on the right side, and you would hit dullness quicker. All right, and now I'm going to auscultate the same spots that I percussed in your back. And I'm just going to have you breathe regularly and keep holding on to your shoulders like you are. Let's turn my stethoscope on. All right. Move this down a little bit. Sorry. Okay. Now I'm just going to listen to the front. I'm going to have you hold your arms up for me, please. All right. Now I'm just going to go right here. Ooh, and then I go down. Sorry. Okay. Down. About that right here. All right. And now I'm going to do the same thing to the front. Raise down a little bit, sorry. It's okay. Alright. Okay, so I auscultated everywhere, and I didn't hear any signs, any adventitious breath sounds such as like bronchi, wheezing, or friction rub. And if I did hear anything abnormal, I would do some other tests, such as testing for bronchophony, egophony, and the whisper test. If I did the bronchophony, I would go down your back and I would listen, and I would have you say 99, 99, 99. And if I could hear it clearly, then, and if it wasn't muffled, that would indicate more issues that I would need to look at. And then for egophony, I would do the same thing, except you would say E, E, E. And if your E sounded like an A, that would indicate that you had fluid consolidation. And then I would do the whisper periloquic test, and I would do that. I would have you whisper 1, 2, 3, and if I could hear it real loudly when you're whispering, that would indicate that you also have like fluid or something in your lungs. And I think that is all. That is all right now. You have good normal breathing pattern. You don't have any signs of stridor or retractions, nasal flaring, or clubbing or anything like that. So I think you're good to go. Okay, have a nice day.
Thank you.